safety management for CAR T-cell therapy, I think, is well established now, and we don't have any major problems in getting around the early toxicities like CRS and neurotoxicities, because we have very well-established guidelines. So there are guidelines for both managing the CRS as well as neurotoxicity from the EBMT, but also from the American Society. And if we follow those guidelines, I think we are safe. Most patients will be safe. We've learned that it's important to treat acute side effects early with tocilizumab, and in some cases with steroids, and this way it's really manageable. We have a lot of more survivors after CAR T-cell therapy, and that means that now, of course, we need to put our focus on the long-term safety, and there are some issues that are still unsolved. For instance, 1/3 of the patients will develop long-term cytopenias. Some of these cytopenias may last for several months until patients recover. They are probably not related to the issue of lymphodepleting therapy, but are maybe some immunologic late side effects of the CAR T-cell treatment. So there's an issue that also mechanistically has not been solved. The issue that has been solved is the immunoglobulin depletion after CD19 CARs. There we know pretty well how to manage these patients. We substitute with immunoglobulins in case of very low levels below 400 IgG, or we are also able to substitute patients who have chronic infections or who are scheduled for surgical interventions. And then the final, and also in terms of infections, we have some good guidelines on prophylaxis against viral and fungal infections. I think that's also important to mention. The long-term safety in terms of secondary malignancies is not well established, because patients have not lived long enough to, let's say, experience many secondary cancers. It seems that some of the patients may get myelodysplastic syndromes. However, it's still unclear whether that's a direct effect of the CAR T cells, but we rather think it's an effect of the previous chemotherapies. That's still not quite clear.